Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, all eyes on Tropical Storm Paeng as it is forecast to gain more strength. Signal number 2 now raised over 6 areas. These include Catanduanes, Albay, Sorsogon, eastern portions of Camarines Sur, northern Samar, and northern portion of eastern Samar. It was last spotted 410 kilometers east of Borongan City, eastern Samar. The State Weather Bureau says Pag-asa says this may hit land or pass very close to Catanduanes tomorrow morning. Meanwhile, more areas have been placed under signal number 1 over several portions of Luzon, Visayas, and Mindanao. Again, it was last spotted 410 kilometers east of Borongan City, eastern Samar. Paeng has caused flooding in several areas in the country. Several barangays in the province of Capiz had ankle to knee-deep water. This was triggered by moderate to heavy rains. The local disaster response agency is constantly monitoring the area. A Facebook post by a netizen in Calibo, Aklan shows murky waters that reached knee-deep on Thursday afternoon. The owner of the video says this is the first time he experienced this kind of flooding in the area. In Gihulngan City in Negros Oriental, over 1,000 residents have been evacuated due to flooding. In Barangay Poblacion, houses near the river have been submerged in water due to non-stop rains. In Gihulngan, a black Toyota Hilux driven by a Swiss national was swept away at a spillway after attempting to cross raging floodwaters. Passengers were rescued by the City Disaster Risk Reduction personnel. And what else can we expect from Tropical Storm Paeng? Let's go straight to the source of the story. We have University of the Philippines Resilience Institute Executive Director Mahar Lagmay. Mahar, good to see you again.
Hi.
Thank you so much for joining me.
Yeah, too, Pinky. Good morning.
Okay, Director, so first tell us, I saw your tweet at ang sinabi mo nga, get ready, prepare, maghanda. What are you seeing in terms of the strength, the track of Paeng?
Can I share my screen so that I can explain,
Absolutely.
answer well? Is that okay? I already arranged for screen share. Is it okay, Pinky?
We're gonna do that right now, Mahar. Let's see if they're ready to do that.
Yeah, here you go.
Okay.
Do you see the screen that instead of my face?
Yes, I do.
Okay, so what I tweeted last night was prepare with an exclamation point, and I said now na, no? Just to get the attention of many Filipinos or more Filipinos. Kasi there's this confusion on where landfall will happen. So I just like to explain that the tracks, no, there are many agencies from all over the world who do that. And they try to make their own. So, siyempre meron mga discrepancies, no? Like for example, yung JMA, yung JTWC, yung military ng US Navy, they make their own, no? What's important to realize also is that the closer the typhoon is to landfall, the more accurate the forecast is in terms of the track of the cyclone, no? So this one is several days before. Nakita maraming mga tracks that veer away from the Philippines, but there are some who project na tatama sa Luzon, no? And the official weather agency of the Philippines is Pag-asa, no? So they have their own. So for official documentation and purposes, ito dapat ang mga sinusunod, ano? So they have that track, and it says na it's going to make landfall somewhere. I think this one is in parang Dinggalan yata yan, ano? Sa may Gabaldon, no? Now, okay. So, merong mga points, no? And some with the letter T, no? Yung letter T means it is typhoon strength, no? When you say typhoon strength, that refers to the wind strength. The winds, no? The strong winds is one type of hazard kasi it can topple trees, pwede kayo mabagsakan, it can rip off the aluminum sheets, no, yung mga steel sheets ng inyong roof, and then when it flies it can hit you, you can die. That's the hazard. That's one type of hazard that we need to prepare for. So ngayon pa lang nagpe-prepare na dapat, tinitrim yung mga trees.
Opo, okay.
Para hindi masyadong bumagsak or hindi bumagsak sa inyong bahay. And when Pag-asa said that they predict it to be typhoon strength, no, that signal, ayan, according to the revised scheme, signal number 4 by ito, no, 118 to 184 kilot.
Yeah.
Yes, Pinky.
Yeah, typhoon is 118 to 184 as we're showing on the screen right now. Kasi para po maintindihan natin, from tropical depression, it goes to tropical storm. And then, meron pang severe tropical storm. After that is typhoon and then super typhoon. Okay, so what track...
Yun yung nakalagay na T, no?
Yun yung T na nakita natin earlier in the graphics that we were showing. But, Mahar, so here's the T, no? If we can take out our... Where is the track of the typhoon? Are you seeing anything different about this?
Yeah, you can see it now. Yeah, there. It's right now the typhoon is over. Can you see the arrow of my computer, the cursor?
We can see it. We can see it. It's on S right now.
Somewhere here. Yan. So it's going to go here, no? And then traverse this track, and then on 30th of October, Sunday, according to the bulletin released by Pag-asa this morning, 28 October, 5 a.m. No? So nagpapalit yan, no? Nag-update sila. So, yan, 2 a.m. Sorry, tama ba yung ano ko?
Sunday, October 30, 2 a.m. You're right. Yeah.
Banda rito magla-landfall. But you are preparing only for the wind strength here, and that is only one type of hazard. Okay? There are other hazards associated with cyclones. Okay? These are the floods, the landslides that can be triggered by the strong rains, as well as storm surges. Okay? Those are the other hazards. So there are 4 hazards associated with typhoons. No? So wind strength, we know we have to prepare for that. What is important for floods and landslides is that we should know the amount of rainfall that will be dumped into your area. Okay,
Mahar, sorry to cut you though, because we don't have a lot of time to talk about this. What we were seeing, and at least I was seeing with the Pag-asa forecast, is that malaki po yung nakikitang yellow at pula doon sa mapa, which means yellow is a lot of rainfall and red is more than that even, di ba?
That is correct. Bali yung black and violet ang titignan nyo. And at what time it can happen according to the forecast. Kasi that rain will transform into floods, di ba? And then that is the hazard. The rainfall is not the hazard. Nobody dies from rain. People die from floods. So we need maps that would show you what the hazards are in your neighborhood. So when I said prepare, look at these maps, no? Kasi pag may warning, you want to know if it's safe in your area and where to go if it's not safe, no? So hindi lang yung hazard, kundi the places where you should go. This is the place where I live in, no? And you can see it from the noaa.up.edu.ph. And then sinabi na sa bandang Nueva Ecija. So I went to Nueva Ecija, tinignan ko yung flood hazards, saka landslide hazards, and storm surge hazards. Kumbaga, as early as now, know your neighborhood para alam mo kung babahain o hindi.
Yeah, but Mahar, how can we know? Do we go to noaa.up.edu.ph? Ganun ho ba yun? Is that what you're saying?
Well, that's one way. That's one way to prepare. Go to the website. You can check your neighborhood, whether there's a threat to flood, landslide, or storm surges. No?
And question, Mahar, is that
yes.
real time? If we go now and we go to...
These are pre-prepared maps, no? These are pre-prepared maps. That's why I said it's good to use this in combination with the rainfall forecast. Yung pinakita kong ito. So if you see that it's black or pink, there's a threat for strong
Black
rains
or
that
pink.
will transform or can transform into floods and trigger landslides as well.
But what
So
about
yan
the...
ang dapat i-check in combination.
But Mahar, isn't the red
or the
also
flood might have sense.
something to consider, yung red? Isn't it supposed to be red, the parang maroon at black?
Yun ang tingin ko na malalakas na ulan. It's saying it's more than 100 millimeters. For landslides, in our experience, at 100 millimeters, that's enough to trigger landslides.
All right. Last question, Mahar, no? I have another guest. So, sabi mo nga, prepare. How do you see this, Paeng, in terms of rainfall? Is this something that, siguro in layman's terms, papaliwanag mo sa amin in terms of wind strength and in terms of rainfall?
Okay, the wind strength is typhoon strength, no? 118 to, ilan ba yung sinabi kanina? 184. Malakas yung 184 na yan, ano? Sa Metro Manila, yung Glenda, it was about 135, 140 kilometers per hour, no? Yung wind strength niya. So, we all remember Glenda because that was just fairly recent. Now, yung rain, mukhang nakakabahala ito, no? Kasi itim ang lumalabas doon sa may area ng Metro Manila. Tapos, yan ngayon pa lang, meron na dyan sa Bicol na nangingitim. No, it's going to be tomorrow, 29, no? And then, 8 p.m. sa evening, it's going to, well, it's predicted, it's forecasted to dump heavy rains according to Weather Manila. He's from a faculty member of the Institute of Environment and Meteorology sa UP, no? So he does this.
Thank you.
So this is very important. Combination, the rainfall, which can translate to the hazard of flood or landslides.
Thank you so much for this, UP Resilience Institute Executive Director Mahar Lagmay. Thank you, sir. We will be taking a very short break. We'll be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our source today, Philippine Coast Guard spokesperson Commodore Armand Balilo. Commodore Balilo, welcome back to The Source. It's good to see you again. Sir, update muna tayo sa mga ports, please.
Well, marami nang nadagdagan yung mga areas na merong public storm warning signal based doon sa very recent forecast ng Pag-asa. At kung di ako nagkamali, pati yung Central Cebu ay meron na. Ngayon, ang binabantayan natin yung Eastern Seaboard. Lahat ng mga pantalan sa Eastern Seaboard ay merong mga stranded passengers, in particular sa Matnog Port at saka mga ports dito sa Northern Samar. And by ngayong araw na to, madadagdagan siguro yung stranded passengers na around 1,200 na based on our latest report.
In total, sir, there are about 1,200 passengers already na naghihintay po at stranded sa mga oras na ito?
Tama ka, Pinky, no? And that is only from Matnog Port and Northern Samar.
I see.
And dahil kanina, wala nang biyahe sa Northern Cebu. At ang problema kasi dito, pagka ganyang may bagyo, dapat pati yung pupuntahan at saka dadaanan walang bagyo. So maaring yung pati Metro Manila na mga biyahe papuntang Visayas ay baka madamay at magkaroon pa ng karagdagang stranded passengers by the end of the day.
Yeah, Commodore, I guess it's just dahil nga mukhang malakas ito, no? At it's not too near and it's not far right now, hindi ho ba? Because the forecast is really Saturday and Sunday. Pero as you mentioned a while ago, it's already signal number 2 and 1 in some areas in Visayas and Luzon. Paano ho yun? Pero down south po kaya? Kasi tatama din yun from the Visayas eh.
Yes, yung Visayas will be affected. Pero tayo kasi nakabase tayo sa forecast ng Pag-asa. Kung public storm warning signal hindi naman naka-raise doon sa area, pinapayagan natin yung mga barko na maglayag. Ang advice natin sa mga pasahero, better check palagi yung forecast ng pag-asa, at pangalawa, you contact your shipping provider kung sakaling merong mga changes, dapat malaman ninyo para maplano nyo mabuti yung paglalakbay nyo ngayong undas. I'm sure everybody wants to observe yung itong undas, pero hindi natin dapat i-compromise yung safety.
Right.
At medyo malakas tong bagyo at ayaw natin magkaroon ng anumang report or incident sa karagatan na mangyayari dahil meron naglayag.
Have there been any rescues so far?
So far, nakita ko yung mga reports nyo, pero on a part of the Philippine Coast Guard, wala pa naman na ibabato sa amin ng mga rescue. But we have instruction already dun sa aming mga deployable response group, mga units, to coordinate with the local government units ng mga probinsya na affected para makatulong tayo dun sa mga rescue operations.
Yeah, and everyone on board right now within the members of the Philippine Coast Guard, sir, because of Paeng?
Yes, we're on heightened alert since Monday, and for the security and para sana sa travel, no? Pero dahil may bagyo, pati yung safety tsaka yung pag-monitor ng mga flooded areas will be also doing that, at magre-respond tayo kung kinakailangan.
Yeah, we hope, of course, for everyone's safety, together with authorities, the members of the Philippine Coast Guard. Armand Balilo, sir, spokesperson of the Philippine Coast Guard. Maraming salamat po sa inyong oras, and take care.
Salamat, Pinky.
We'll be taking a short break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. I'm Pinky Webb. Despite the easing of restrictions and opening of borders in many parts of the world, the threat of COVID-19 remains. More than 2 years since the pandemic started, more businesses are now stepping up their strategies to adapt to the changing business landscape. One of them is biopharmaceutical company Astrazeneca that provided and manufactured one of the first vaccines against COVID-19. So, what's next for AstraZeneca? Let's go straight to the source of the story. We have AstraZeneca Philippines President Lotis Ramin. Lotis, welcome to the source. Thank you so much for your time.
Good morning, Pinky.
Tell us the importance or even the impact of AstraZeneca COVID vaccines that were delivered and, of course, utilized here in the Philippines.
Well, we're truly proud, Pinky, that AstraZeneca has been at the forefront of the fight against the pandemic, including in the country. Globally, we have released 3 billion vaccine doses to more than 180 countries, including the Philippines. Now, more than this, the shared commitment to global equitable access has enabled saving more than 6 million lives worldwide, and in the Philippines have prevented more than 50,000 deaths. And also, as you mentioned, AstraZeneca vaccine was the first vaccine delivered through COVAX in March 2021. So it was instrumental in the early vaccine rollout in the country. And according to the 2021 KPMG vaccination report, the overall early vaccination rollout helped save $3.2 billion in healthcare costs. So truly meaningful impact. Now, it's also worth noting that recently the WHO Strategic Advisory Group issued a statement or recommendation to countries that are using either inactivated or mRNA vaccines as primary vaccines to consider viral vector, such as AstraZeneca, as first or second booster dose. So with this in mind, Pinky, we will continue our commitment to ensure that Philippines has access to AstraZeneca's innovative medicines to protect Filipinos from not just COVID-19, but also other serious non-communicable diseases.
And absolutely, especially now that there's a lot of encouragement coming from the government to get boosted. But I want to kind of shift also that despite COVID still being with us, it's been critical, of course, also for the DOJ to somehow revitalize its long-term goals when talking about the universal healthcare law. I wanted to find out from you, are there plans, aside from the COVID-19 vaccines from AstraZeneca, to support the universal healthcare law, short, medium, or long-term plans, and how?
Indeed, Pinky, very important topic. And we are one with the government, of course, and the Department of Health in wanting to achieve better health outcomes for Filipinos. And this requires a holistic view of the disease journey. And sabi mo nga, during the pandemic, most especially, probably these other diseases were deprioritized. So in the last 4 years, AstraZeneca has been working on enabling partnerships and solutions, looking into gaps throughout the disease journey, especially yung early screening and detection of patients, because this has serious implications in the outcomes of patients. No, one example that I want to zoom in is cancer. It's
Okay.
a very serious disease, and lung cancer in particular, Pinky, 1.8 million people die from lung cancer worldwide each year. And in the Philippines, it's actually the leading cause of cancer death now. And largely, majority of the patients are diagnosed late. And so we really want to do something about this. AstraZeneca has the vision of redefining cancer care and ultimately hoping to eliminate cancer as a cause of death. No, so building on this bold vision, what we did in the Philippines is we launched the Lung Ambition Alliance in partnership with different stakeholders that promotes better disease awareness and disease education, so patients are informed earlier. And also we enabled early screening through the use of artificial intelligence software solutions looking into chest x-rays. And we are committed, of course, to continue to expand our capabilities and initiatives, as well as partnerships, to reach more patients and hopefully improve lung cancer patient outcomes and prognosis in the country.
But apart from cancer, are you likewise focusing on other illnesses or diseases to support the universal healthcare law?
Absolutely. No, we do a lot of focus on other serious non-communicable diseases. So AstraZeneca in the Philippines, we have 4 major areas of expertise: cardiovascular, renal, metabolic diseases, respiratory diseases, cancer as discussed, and of course vaccine and immune therapy. And we do have solutions for all of this. We look at the holistic disease journey of patients. Now, another example, Pinky, is chronic kidney disease, another
Yeah.
burning platform, no? Because chronic kidney disease is the 4th leading cause of premature death in the Philippines. And in fact, there is this local study conducted by NKTI that says or shows that one Filipino develops chronic kidney disease every 40 minutes. And one Filipino
Every how
with
many?
CK every 40 minutes.
Wow.
No, and very serious. And one Filipino with chronic kidney disease progresses to dialysis every hour. In fact, in 2021, hemodialysis stopped the procedural reimbursements through PhilHealth based on our understanding. And so clearly, it's very important to detect this early so that patients will not progress easily to dialysis or even transplantation. So to address this, in AstraZeneca, we also focus a lot on early detection and screening. And so we launched Act Now, to drive the sense of urgency. Act Now against chronic kidney disease. And we partnered with the medical community, Diabetes Philippines, nurse educators, as well as some local government units to again promote disease awareness, disease education, and also enable access to simple screening tools, so that patients can be aware earlier and can be managed earlier as well. And we continue this commitment, and we look forward to working with the government to continue to enable solutions for earlier management of diseases in the country.
I think it's very important that you mentioned 2 diseases or illnesses that could possibly be prevented or prevent its progression. Lung cancer, as you said, is the leading cause of death of cancer here in the Philippines. And then you're right,
Yes.
ang dami ho talagang nagpapadialysis dito sa bansa. So are there other ways, apart from this, we're talking about plans, policies, directions towards early detection, but also contributing to, Philippine society as a whole?
Yes, very important question, Pinky. So we have in AstraZeneca, what matters most to us, of course, is the impact to patients, people, and society, right? And the core of what we do is healthcare and healthcare access. So speaking of which, other than the initiatives that I mentioned earlier, we have more than 40 years legacy of delivering innovative medicines in the country, and we do put a lot of efforts and resources behind research and development. We have shown how we have courageously stepped up as an organization with our innovation and partnerships during the most crucial times of the pandemic. And also on a daily basis, our medicines, our innovative medicines, helped hundreds of thousands of Filipino patients. The solutions that I mentioned earlier has enabled more than 300,000 early screening for chronic kidney disease. And we have done more than 19,000 scans for early lung cancer detection, which are truly meaningful. And with our disease education, we have reached more than 1 million patients also through various social media platforms. Now, on top of healthcare, of course, we also put a lot of focus on promoting a great place to work culture in our organization. We put a lot of focus on inclusion and diversity, a very important topic to me, being Filipina also. And we believe that inclusion and diversity is crucial to fostering or propelling further innovation. No? That's why we're able to come up with all these solutions. And of course, I'm proud to share that recently, Pinky, we have been certified by Great Place to Work, which is the global authority on workplace culture. So, yes. So it's a very holistic approach. But ultimately, I'm extremely proud of our research and development, our innovation, because these medicines, they help us bridge huge unmet needs, diseases where there's no or very limited solutions today. And that's our commitment. And also, we won't be able to deliver this innovation without the AstraZeneca team, our people. We're working relentlessly together to deliver meaningful impact to patients and also the society.
Lotis, very quickly, just one last question. What matters most to AstraZeneca in the Philippines?
So what matters most to us, Pinky, is to deliver our mission. And our mission, as you probably saw in the earlier discussion, was to uplift the standard of healthcare for Filipino patients. So the vaccine efforts was just one example, but we're doing so much more beyond that. And we're strongly committed to continue to bring, number one, innovative medicines into the country and enable sustainable healthcare ecosystem solutions through public and private partnerships.
Thank you so much for joining us here on The Source. Lotis Ramin, AstraZeneca Philippines President. Thank you, Lotis. And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.